Welcome to Ask Alumni, the podcast where we talk to alumni of Loma Linda School of Medicine to gain insights and information to help students and young alumni on their medical journey. Hello, my name is Calvin Chuang and I'll be your host today. And today we're going to be talking to Heidi Christensen, Loma Linda class of 2009, about the wonderful world of primary care sports medicine. Dr. Christensen, welcome to the podcast.
Thanks for having me.
Now, primary care, like I just stumbled across pronouncing it. Primary care sports medicine, it's a mouthful. What is it? What is the specialty and how did you get here?
So I guess I'll start with how I got here. I always had a big drive towards the field of emergency medicine. From before I started medical school, I volunteered in one of the local emergency departments in college and kind of just stayed on that path. I really liked the excitement and the variety of what we saw. And as I was approaching the end of medical school and interviewing for residencies, I interviewed at a couple of different programs that had a fellowship in primary care sports medicine and got to learn more about that. And growing up, having played multiple sports all my life and having that be one of my passions, just really intrigued me, being able to take care of a different population than I did in the emergency department with, athletes of all levels, the weekend warriors, the professional athletes, semi-pro, high school, and then, just your typical person who gets hurt being active on a daily basis. It's a lot more, I guess I should say some people consider it more of a non-operative orthopedics, but I think that's a very, very oversimplified explanation of what it is. I think it's a lot more than just taking care of non-operative orthopedic injuries. Clearly, you do take care of your fair share of chronic overuse injuries, acute injuries, fractures, sprains, strains. But it's also just general health care of the athlete and active people. Medicine for the athlete can be very different if there are medical issues involved compared to the general population.
Okay. So this is a fellowship, right, that we're talking about. It's not a residency. Mm-hmm. You had to do a residency first?
Yes.
Okay. So what was the residency in?
Yeah, you can take multiple avenues to get to primary care sports medicine. I would say the most popular is primary care, family medicine, pediatrics, and then those of us who did residencies in emergency medicine also can do the fellowship as well as PM&R, physical medicine and rehabilitation. So there's a lot of different routes that you can get to primary care sports medicine, but it is a year-long fellowship no matter which route you go down.
Okay, cool. Now, how long have you been doing the sports medicine?
I finished fellowship. Yeah, I finished fellowship in 2013. So I guess this is my 8th year. And wow. I've been doing a combination of emergency medicine, acute emergent care, and primary care sports medicine clinic, which is a referral-based clinic that I do currently.
Oh, nice. So lots of variety then.
Yeah, definitely. When I was, again, getting to the end of medical school and thinking about what I wanted my career to be like, they always tell you in emergency medicine that the burnout rate is really high. And I had several different professors at Loma Linda and even in residency attendings who told me that I should probably find a niche in the field of emergency medicine because working straight in the emergency department can take its toll after, a number of years. And so I guess with my passion for sports, having been an athlete myself, having had a number of injuries that I've had to, seek treatment for, it just seemed like a natural fit for me. And I think it's been a really nice balance between working acute care shifts and then having more of a referral-based specialty clinic where I get to put on a completely different hat. And I think it also offers me a little bit more of a predictable schedule. So being a mom, some days makes it easier having that set schedule in clinic, as opposed to, am I working night? Am I working evening? Am I working the day shift? Am I going to be able to take my kid to his appointment or his gymnastics class? So I think the variety just kind of fits perfectly for my personality. I think a lot of us who go into the field of emergency medicine crave the variety as it is. And I guess this is just the variety on steroids for me.
Well, it's nice to hear that you made it work for you, and you actually, like, it sounds like you consciously considered your lifestyle when making your career choices, and also that it sounds like your even some of your injuries, your past injuries, actually informed your specialty, which is kind of curious as well.
Yeah. Definitely. I think every experience in life kind of frames our perspective on life and our passions down the road, especially in our career, if we get to be so lucky to pursue passions that we have in our careers.
Nice. So you've been doing this specialty for a while now. What's the best part about being a sports medicine physician?
I think just being able to have that common connection with patients, because I've been there. I've been injured. I've, had to skip my senior year of basketball and softball because I had a career-ending injury my senior volleyball season. Just being able to sit down with a patient and empathize with them, let them know that I've been there, I know what they're going through. I think it's just kind of a special relationship. And coming from the field of emergency medicine, where you don't get to build relationships with a lot of your patients, most of them, it's a different kind of fulfillment. I may not be saving lives like I do sometimes in emergency medicine, but I do get to build those long-lasting relationships. And I do have patients who come back time and time again after they have new injuries or are wondering about how to prevent future injuries. And it's a special niche, I think, for me.
Nice. Are there any challenges about this specific specialty?
I think, as in every field of emergency medicine, there are those cases that are not straightforward and take a little while to dig through to figure out what's going on. I think sometimes with modern society, I think it's kind of the Amazon phenomenon. We want treatment. We want to get better with a click of a button, with taking a pill, with having a quick procedure or surgery. And so I think convincing patients to buy into what I'm saying, to want to be motivated to follow the treatment plan that I'm recommending. That may not be just a quick shot to get you better, but that may be a month or two of home rehab exercises. And so I think just kind of getting people to take a step back, to want to put the time in to treat themselves in a more conservative manner can be challenging sometimes.
Yeah, that's true. That we do live in a society these days that's like instant gratification. So yeah, unfortunately the body doesn't respond to our instant needs.
Right.
So when you're going through residency and fellowship, was there any vast differences from actually learning about it and doing your residency and then what you're practicing now? Or is it pretty similar?
I think it kind of depends on where you land. I started out in academic medicine. And so with the population that we see in the emergency department, it's very different than where I landed here in Denver, in more of the suburban area. So I think, those cases at level 1 trauma centers, academic medical centers, you're definitely going to get a lot more complicated, sicker patients and just a different patient population. I think with respect to sports medicine, in fellowship, I took care of a wide range of athletes and teams. I chartered planes and traveled to different cities all over the country with an arena football league team. I was team physician for the San Jose Sharks for a time. And then here in the South Denver suburbs, my husband and I, who's also a sports medicine trained physician, also a Loma Linda alumni, we take care of a few high school teams in the area. And so I think it just, with any field you go into, it just depends on the area you live in. Just the population is so different. Personally, a lot of people, I think, will go into sports medicine thinking that the glamorous thing is to take care of the professional athletes or the semi-pro, being at the Olympic Training Center. But I feel like the more time that goes by and the more experience I get, I really like taking care of the high school athletes, the smaller colleges, the non-professional. I think that they're really grateful for what you do in helping them. And I think it challenges you a little more too, because when I was taking care of the Sharks, it's just MRI after MRI after MRI, and you've got every subspecialist taking care of every little need. And when you're the only one taking care of a non-professional team, you get a lot more experience and get to do a lot more. It's more fun. It's more challenging. You get to think through cases and figure out what's going on, as opposed to just ordering that higher level imaging study or what have you.
Mm-hmm. That makes sense. And it sounds like quite a difference between, say, academic setting and a professional setting, and also between professional athletes and high school athletes. So depending on you, it's kind of like pick your own adventure kind of a specialty.
Yeah, exactly.
Now, while we are on professional athletes and that route, I know you can't break hip or anything, so just a quick yes or no. Have you treated anyone really famous that we would probably recognize on the TV or by name?
Admittedly, I did not grow up watching hockey, so I don't know if I'm the best for that. Otherwise, I've probably come across some bigger names, not like a Tom Brady type level player, but probably some recognizable names.
Okay, great. Now, if you were doing now that you know what you're doing now, if you were looking back now at yourself as a student, is there any kind of things that you wish you would have known back when you were a student to help you be where you're at now?
I think I got a lot of great advice being at Loma Linda. I think maybe just in general, knowing that within the field of emergency medicine, it's a lot more mundane than you would think, especially practicing in more of the suburb type area now. I feel like those cases where you're saving a life or making a huge impact on a patient and their case are fewer and far between. I think a lot of people utilize the emergency department because they don't want to wait to see their primary care physicians. They've had this chronic pain for years, and they think coming into the emergency department, you're finally going to figure out what's going on. And that's a really tough position for a physician who has no relationship with that patient to be in, because they're looking to you to be their savior and figure out what's causing their issue, and you're letting them down most of the time. I think one piece of advice that I did get that still sticks with me today, that I tell every student that rotates with me, I did have a professor at Loma Linda who said, when you're considering specialties, what residency you want to do, think about not just the best of that field, but the worst. You know, what is it going to be like on your worst day? What are the worst cases that you're going to see? And can you deal with that? And I thought that was really great advice, because I think everyone can pick good things out of each specialty, but really the day-to-day stuff, you know, what are the worst things about that specialty, and am I still going to be fulfilled by it? And I thought that was the best piece of advice that I ever got.
Yeah, that is very valuable advice. I think they can be cross applied to multiple careers, just not any medicine.
Yeah.
What does a typical day for you look like?
It depends on the day. I think, you know, the only predictable thing is pretty much sports medicine clinic. Otherwise, shifts are kind of scattered here and there. Sports medicine clinic, I am an 8 to 5 physician, unlike when I'm doing emergency medicine. So that's different for me. But I think each injury, each case that walks through the door is different too. So it's hard to predict every day what it's going to be like, because it's definitely not the same each day. I could be seeing a ton of concussions like I do during football season. I could be seeing a lot more sprain strains or chronic overuse injuries one day. I could be doing a lot of ultrasound guided injections. So I think sports medicine is kind of cool because there is a big variety of what you can be treating, whether it's just helping an athlete to control exercise-induced asthma, or, you know, procedures, which I love. It's kind of my passion. I did some extra training in ultrasound guided sports medicine procedures and some diagnostic ultrasound for musculoskeletal stuff too. So I think it allows me to be even more versatile and see a bigger population too.
That's awesome. It sounds like, from what you've mentioned previously and what you've just mentioned, that it's very specialized. Are you working as a team, or is it in some cases you're the only physician and taking care of this injury?
Well, I think being a specialty consultant, you're kind of working on, or as a greater team, even though you may not be working in clinic with that person who's referring you a patient. I think as a consultant, it's still really important to involve the primary care physician or whoever it is that referred you that patient, so that you can make sure that you're getting the patient the best care, most tailored to them and their injury. So I would say probably in a majority of fields of medicine, you are working on some sort of a team, but it's definitely different in clinic as opposed to my experience with team-based medicine in the emergency department.
Okay. And I mean, you're now based in Denver, right? If I'm understanding correctly. Is it hard to find a role in sports medicine when you move to a city like Denver, or even maybe more rural America?
Yeah, it can definitely be challenging. I think in the bigger metro areas where you have a lot more orthopedic subspecialties, where you have, like we do in Denver, a primary care sports medicine fellowship program, a lot of primary care sports physicians just stick around and land in the area. And so, yeah, it can be challenging to find jobs in this field. I think the best way to go about doing that in any new city is just to make yourself available to the local high schools and the athletic trainers. I think they, just being on the sidelines, being present, being able to help them out with acute injuries or follow up whenever they need, makes them look good. And so they want to continue to send you business too. So I think sports medicine is just big on volunteer work. You've got to be active in your community, be well known, be that resource for people so that they want to continue to send you patients.
So it sounds like you have to put yourself out there a little bit, be on the sidelines and just have your face be recognizable by the locals.
Definitely. Yeah. Unless you're a part of a primary care practice or some other practice where your partners in office are filling up your schedule. I just think sports medicine is one of those unique subspecialties where you need to be outside the office doing a lot of volunteer work too.
We're talking to Heidi Christensen, a sports medicine physician. More with her after this break.
Today's episode is brought to you by the Lending Library of the Alumni Association, School of Medicine of Loma Linda University. Did you know that the Lending Library has allowed students to complete medical school at Loma Linda University without purchasing a single textbook? Take advantage of the wide variety of medical textbooks and review books available, as well as a number of free books students can keep. The library is open 8 a.m. to 6 p.m. Monday to Thursday and is located at the Alumni Center on Anderson Street. For more information, visit llusmaa.org/lending-library or call 909-558-4633. Support also comes from the Paying It Forward Scholarship of the Alumni Association, School of Medicine of Loma Linda University. Every year, junior and senior medical students at Loma Linda University are eligible to receive a scholarship equivalent to half of 1 year's tuition. Students who receive this scholarship also receive advice and encouragement from the alumni who helped fund their scholarship. For more information, visit llusmaa.org/paying-it-forward-scholarship or call 909-558-4633.
Welcome back. We're talking with Heidi Christensen, sports medicine physician out in Denver, Colorado. We've talked a lot about your job at this point and some of the ins and outs of that. Let's just talk about just lifestyle that it provides. We've touched on it briefly, but could you just maybe summarize what kind of a lifestyle sports medicine provides?
Yeah, I think, it's very busy in the football season. So every fall, depending on how many teams you're taking care of, my husband and I, he's also sports medicine trained. We take care of 3 high school teams between the two of us. So football season is a very big time for us on Fridays and Saturdays, covering games outside of clinic. Things can tend to slow down a little bit because football season is a very high trauma, high injury time of year. So it tends to be the busiest, but after that, I think things calm down quite a bit where you are kind of tailoring your clinic schedule to, what kind of volume you're seeing. It can be anywhere from, a day a week to 5 days a week, depending on what you want to make it. We talked a little bit about being involved in the community. I think it's also really important to visit local clinics, to market yourself to other physicians who you can partner with as well. So I think it's just kind of it's what you want to make it. I do a couple of days a week of referral-based clinic, and then the other time I'm practicing emergency medicine. So it's kind of a good lifestyle to be able to jump back and forth. For me, it kind of fulfills my need for variety, like we talked about before.
Yeah, and you are also a mother. How is that balance between being a mother and being a physician?
It's tough. I won't lie. I'm very lucky to have a fellow physician husband who understands the time issues. But I think, again, between emergency medicine and sports medicine, you can kind of carve out a little bit of predictability in your schedule, but then also on the emergency medicine side, have more of that variety so that you can have some days off during the week to be able to make school programs, sporting events, doctor's appointments, and then just to hang out with your kids, be there for them during the week and not just Saturday, Sunday.
Are there any strategies that you've learned now that you could pass on to someone who is going to face this in the future?
I think it's so different for each mother. When I was in medical school, there was an emergency attending who only worked nights because she wanted to be able to be home in the morning, take her kids to school, and then pick them up in the afternoon or in the evening after sporting events, and then go to work. And she would sleep during the day. For me, I can't do all nights. It's just not my personality.
Yeah.
So I think being able to be part-time in emergency medicine, just have a little bit of flexibility here and there, because it's easier to switch a shift with somebody in the emergency department than it is to cancel your clinic when you have a bunch of patients already scheduled. But then also to have those not random, but planned days where you're going to be in clinic just from 8 to 5, and you're going to be able to, go home and play with the kids and cook them dinner and know you're going to be able to be there, instead of getting killed on a shift where you're working later into the evening and not being able to make it home by bedtime. So I think having a little bit of flexibility between those two types of schedules has really lended itself well for my schedule and being a mom. I've got 2 very young kids right now, so we'll see how it changes as they get older and start school.
And as they grow up, as a sports physician, are you thinking about what sports they will play? And are there certain sports that you're like, no, they are not playing that because I've seen X?
Yeah, I won't lie. I think my husband and I both have those feelings. Luckily, we're both big into basketball. He played baseball. I played softball. I also played volleyball. He didn't do football. I'm kind of thankful for that. So maybe our son won't lean towards that. Because I have seen some pretty good injuries in some high school kids with, career-ending blowouts of their knees, stuff like that. Concussions are a hot topic in the realm of sports medicine, and they've been highly publicized with the NFL cases. So those are definitely scary. Of course, I won't get into the research behind it, but it's still concerning when it's your own kid. I think there's a lot of benefit to playing sports in general. And so if my son ended up wanting to play football, I don't think I would tell him no. There's just so many health benefits, physically, emotionally, psychologically, that I think, if they're interested in it and it's something they're passionate about, then probably the benefits outweigh the risks in general.
Well, it sounds like either way they're going to be playing sports. It's not like they're not going to be playing sports. It sounds like you are.
We're a big sports family,
yeah.
So.
So good. You'll have an athletic family then.
Yeah, we'll see.
Now, as you are very specialized in a fellowship, some students or people who are in residency might be considering this fellowship, and they will be naturally considering about pay and salary as well. Mm-hmm. Where does sports medicine fit on the scale of the physician salaries?
So definitely not as much as I would make in the emergency department. And that salary cut was definitely a sacrifice I was willing to make, because I think I'm happier and I'm more fulfilled being able to do sports medicine, which is something that I'm exceptionally passionate about. It takes away some stress of working in the emergency department, 12-hour shifts. multiple days a week can take a toll on you. So yeah, emergency medicine, I think on average, it depends state to state and whether you're rural or in a metro area, but maybe on average 350,000, and sports medicine is probably going to be closer to what a primary care physician would make. And I think they're at the lower end of the spectrum.
Hey, but as you've pointed out multiple times, it's something that you're passionate about, and it brings you joy outside of monetary value, right?
Yes, exactly. And I giggle a little bit because my husband is a primary care physician. So
is there a little competition there between the two of you?
Just a little bit. We were medical school classmates and we did fellowship at the same time. We didn't go to the same program, but we both did the same fellowship. So I would say just with our sports background, we're pretty competitive, including with each other.
Yeah. Okay. What is that like? What is it like to be married to another physician?
Personally, I think it's great. He definitely understands what it's like to have a physician schedule and those types of responsibilities, to be called in the middle of the day or the middle of the night with questions or, some stat lab or imaging study that you got that someone's calling you about after you've gone to bed. He's definitely understanding because he gets that too. And, when I have to go to work randomly, he's always there to help take care of the kids and help manage the schedules and everything at home when he can. So it's nice to have that understanding person, because I do have friends who are married to non-physicians, and it sounds like the schedules and the unpredictability that medicine can bring can create a little tension sometimes. But I think we both also enjoy being able to bounce things off of each other. He's got a different perspective in primary care. I've got a different perspective from my emergency medicine training. We're both primary care sports medicine trained. So I think we both bring different skill sets and different perspectives to the table and ways that we approach common patients. So it's nice to have a sounding board sometimes.
Oh, that's good. Yeah, a sounding board, hopefully, as opposed to like my opinion of this diagnosis is correct and yours, is it?
Yeah.
Now, I noticed on your work email and just looking at where you're at, it says you're a medical director of the urgent care services at Castle Pines Family Practice. Is that correct?
Yeah, I am. I transitioned into that role about a year and a half ago. So I am currently not working in the emergency department. I opted to have a little bit more predictability in my schedule after having our first, and we just had our second 4 months ago. And so it's been helpful to be able to take on a little bit more of an administrative role. And, it's nice because you don't have to be necessarily working a shift to make a salary. So just a lot of different avenues that you can take once you are residency trained in any field of medicine.
Was leadership something that you always thought, I would one day like to become a medical director or another position or of that sort?
No, actually, I don't think so. I kind of got into this just to be working. I dipped my toes in being a medical director in my last job, where I helped build up the primary care sports medicine specialty service line for one of the big healthcare organizations here in Denver, and just really enjoyed it. I think it's fun, again, to put on another hat and be able to help develop and grow something and see it succeed. It's just kind of a different type of fulfillment in the field of medicine.
It sounds like you like giving yourself some new challenges. So this sounds like the latest challenge.
Yeah. I guess that's kind of the athlete mentality, always trying to reach new heights.
Okay.
And medicine too. I mean, it's a never ending learning process. You're always learning something new. You're always reading to try to keep up with the latest, and you're always trying to challenge yourself so that you can do the right thing by your patients.
That's cool. I know you've probably got a ton of these, but because you're in sports medicine, I'm sure you see some really interesting cases and cool stories. Do you have a couple that just come to mind that you're like, I need to share this? This was so cool.
I think those cases differ. I think, for the stories that people ask me, those people who aren't in medicine, they want the gory stuff, the stuff that you're interested in at the beginning of residency in emergency medicine, those, really bad level 1 trauma cases that come in. And then I think as you train more, as you get further into your career, those types of cases change. And so they're probably a little bit more boring to the lay population, but they challenged my mind more because it was harder to get to the bottom of. I think one thing that kind of stands out just for a number of unique reasons, I was doing a pre-participation physical event for one of the colleges that I worked with. Pre-participation physicals, of course, are sports physicals before the beginning of the season, so athletes can qualify to play. And there was a new transfer from another school, a football player who had sprained his ankle a few months before transferring and went through complete rehab with his trainer at the other school and continued to have pain in his ankle. I think he was very resistant to looking more into what was going on. And so there were challenges there too, but convinced him to get an x-ray just to see. There was a little irregularity in one of the bones in his ankle, which prompted me to want to get higher level imaging. Again, met with resistance because, like all athletes, especially collegiate athletes and pro athletes, they just want to play. They don't want to get bogged down and told that they need to pump the brakes and let's figure out what's going on. And once we did get that higher level imaging study, it turned out that he had a big bone tumor in one of the bones in his ankle and ended up needing a pretty extensive surgery, where they had taken a bone graft from his hip, missed the whole season. It was a pretty interesting case. Again, probably not very interesting to a lot of people who are looking for those exciting stories, but definitely a case that stuck with me.
And it sounds like, that's a very traumatic experience for a young athlete. Mm-hmm. And you're probably delivering this news constantly to different athletes. What's that experience like?
It's tough. They're athletes. They want to play. That's their job. That's what they've trained for. They don't want to be told that they have to sit on the sidelines until we figure out what's going on. I think the toughest part during these sports physicals is when you have that athlete coming to you who may have a loud heart murmur or has complained of chest pain or fainting when they're exercising. Of course, those are risk factors for sudden death when you're playing or exercising, and not being able to clear those athletes to play right away is a pretty tough position to be in, because a lot of the times you've never seen them before. You have no relationship. You're just the gatekeeper who's telling them, no, they can't play. And so I would say, although a lot of the times people are understanding, you do get those people who are upset, and rightfully so. But as with any field of medicine, you're just trying to do the right thing for the patient, even though they may not perceive that in the moment.
Yeah. And I'm sure you've picked up on things that maybe later on they were very grateful for you for, or maybe if they didn't express it to you, you could see, some sort of improvement and change because of an injury or something that you picked up. Have you noticed that before? And do you get that experience of like the warm fuzzies when you see someone say recover from an injury or something like that?
Yeah, definitely. There are those people who inevitably recover and don't come back because they don't need you anymore. But I will say those patients that I've been able to work with throughout the entire injury, diagnosis, treatment, and then also giving them the tools they need to prevent future injuries. I think people are in general very grateful for that. I think that's one big part of sports physician's job is not just discharging them after you've treated them, but giving the tools they need to be successful in the future so that they don't have to come back and see you in the future. And I think people tend to be really appreciative of that.
Yeah. And I'm sure as a physician too, that there's something heartwarming about seeing that as well. Yeah,
definitely. Being able to be there when the athletes are bummed because they have an injury that's going to keep them out, and being able to help them get back into the sport as quickly and safely as possible, I think doesn't go without reward, even if they don't express it. It's nice to see people being able to return to the sport and not injure themselves again.
Yeah. Well, this has been a fascinating conversation. Thank you for your time. Before we go, just any last minute pearls of wisdom or advice that you'd like to share to anyone listening out there who might be considering your specialty or just medicine or life in general?
Well, if you're considering primary care sports medicine, I would say do it. My fellowship year was the most fun year of my life. I got paid to watch sports all the time and to hang out with athletes. It was really fun. But I think, if you just have a general interest in sports, you're an athletic person, you've grown up playing sports, doing marathons, bowling, whatever it is, or you just like treating musculoskeletal injuries, concussions, being on the sidelines, I don't regret it. During residency, a lot of attendings and co-residents would tell me there's kind of a saying, it's the $250,000 mistake you're making by doing fellowship. But I think that I've been able to mold my career into what I want it to be. And yeah, I did take that extra year to do the fellowship, but I think that it has benefited me on so many other levels. I think the schedule has made it easier for home life to take care of my kids and be able to take a little bit of time off for maternity leave and not worry. I think for my own emotional health, it's been nice to have those breaks from the world of emergency medicine, which can be incredibly stressful and physically, emotionally taxing. So I think, especially for those going into a high stress residency and field, having that niche within your field can really give you a lot of flexibility and allow you the opportunity to change things up a little bit and not do the same thing day in, day out. So if you're considering a fellowship, I would say do it, especially if it's sports medicine, because I am biased. I think it's the best fellowship and best field out there. Just do what makes you happy and what's going to fulfill you, because there's a lot in medicine that can drag you down. There is, there's a less pretty side. And I think if you're always pursuing your own passions and your own goal and making your career what you want it to be, you can't go wrong.
Very, very solid and sound advice. Thank you. On behalf of the listeners, I'm sure someone here listening will take that on and run with that, so to speak. Thank you again for chatting with us today. Your field sounds amazingly interesting, and I'll next time I see an athlete on TV getting injured, I'll be thinking about your specialty. And with that, again, thank you so much. And that concludes our episode today. Ask Alumni is a podcast of the Alumni Association School of Medicine of Loma Linda University. If you'd like to hear more episodes and podcasts like this, visit our website at lousmaa.org/podcast. And if you have any questions or would like to see a specialty featured on our podcast, email us at lousmaa@lou.edu. For now, I'm Calvin Chuang. Have a blessed day.